morning, class. Today we will be learning injury evaluations and specifically how to take the history portion of an evaluation after somebody becomes injured. So there are four basic components to a clinical evaluation. The one that we will focus on this week is history, but those four components follow the HOPS format. So that stands for history, observation, palpations, and special tests or functional testing. So first, when someone becomes injured, we have to perform our evaluation, and we have three main goals in what we are trying to determine with that eval. So firstly, we are looking at the cause. So how did that injury occur? Sometimes we see when the injury happens, other times we don't. Again, not every single injury is going to be an acute one that happens right in front of you. Sometimes these occur long-term or develop over time. So with how the injury occurred, we are looking at, was the athlete on their own? Did someone else run into them? Do you have someone else that's injured? And did you see the way that their body moved to become injured? Then the type of injury would be what type of tissue has been injured. So this is when we are starting to do our history-taking observation and eventually our special tests to look at if it's bone, if it's soft tissue, is it a brain injury, really what type of tissue has been damaged. And then lastly is the severity. So how severe is this injury? This is a very important one because it's going to tell us if we can maybe help the athlete off the field and continue our evaluation on our own, or if we need to take them to a doctor or a physician, or if it's so severe or it's life-threatening that we do need to call 911 and have them transported to the hospital. Okay, so for our history portion, this is mainly going to be a subjective exam, which is going to be everything that the athlete tells you. So we're not looking at observing it, we're not palpating the athlete. This is just going to be question asking and the athlete answering them for you. So our medical history, anything the athlete tells you. So I have a list of questions here that are very common ones. And as you become better at this, you will be able to tailor the questions to the specific athlete and their injury. But to start out, I want you guys to start with these basic ones. So initially, where does it hurt? You want them to point to a specific location. You want them to describe the type of pain because that tells you what type of tissue could be damaged. So is it a very dull pain? Is it very sharp? Is it aching, throbbing, shooting? Maybe they have numbness or tingling, symbolizing some nerve injury, etc. What makes the condition worse? What makes it better? So this would be maybe they hurt their ankle and putting weight on it makes it feel worse, but when they're sitting down with no weight on that ankle, it doesn't hurt so bad. Did you hear any unusual sounds like a pop, clicking, snapping when it happened? And then what happened? So you want them to describe what happened with their injury in their own words and piece that together with what you observed. So this is actually going to be what you will be practicing this week for your competency, is practicing some of these questions. Other important ones would be trying to figure out if anything else has happened in that area before. So has this injury ever happened before? Maybe they hurt that ankle and they had already sprained it 3 times in the past year. That's going to be very important information. You also want to judge the severity of their pain by using something called the pain scale, which is just a scale from 1 to 10. And the way that I personally do this is say, please describe your pain on a scale of 1 to 10, 10 being the most severe. Usually that means it's the worst pain you've ever felt and you feel like you need to go to the hospital. 1, you can barely feel it. You also want to know if anything relieves the pain. So have they tried taking any over-the-counter medications like ibuprofen? Have they tried icing the injury? What have they done on their own? And then lastly, you want to ask about normal daily activities such as nutrition, hydration. So what have you eaten today? How much water have you had to drink today? Did you get a full night's sleep last night? Etc. Okay, so this is an example of the pain scale, just 1 to 10. 1 being the most mild, 10 being the most severe or the worst pain possible. And sometimes when someone has their adrenaline going, they don't want to think about it, you can use this chart to show the faces that help them determine it. Or if someone is a little bit out of it, they can use this chart to help them rate their pain with those faces. Okay, so asking history questions for a head injury is going to look a lot different than anywhere else on the body because it's usually associated with a lot of memory or cognitive function. Now, we're not going to go very detailed into concussions or traumatic brain injuries for this course this semester because it is our lower extremity course, but we have other classes that we talk about concussions a lot in. So if you do come across a head injury, you want to ask things like memory recall. So what is your name? Do you know where you are right now? What's the score in whatever game they're playing? And can you remember what happened? You want to know if they had any lapse in memory or if they became unconscious at any time. You can ask them what quarter or inning or half it is. You want to know if they've ever hurt their head before. You want to know if they've ever been diagnosed with a concussion by an athletic trainer or a sports doctor before. And then definitely if they've ever been hospitalized for a head injury. Those are all very important questions because once you have one head injury, like a concussion, if you get another one, there could be more serious implications to that. All right, something very important to know for this class is the difference between signs and symptoms. A sign is going to be anything that you are personally observing on that athlete, whereas a symptom is something that they're going to tell you about themselves. So examples of signs, something that you're seeing would be redness in the area, swelling of that ankle joint compared to the other side, maybe discoloration, so bruising. You want to note if that athlete came in limping, if they were wincing in pain, crying, definitely if you see any bleeding or if you can tell that a bone is broken or that it looks different than the other side of their body. Examples of symptoms, anything that athlete's going to tell you about what they're feeling. So this would be that pain scale 1 to 10. Again, descriptive words about what kind of pain it is. If they're having difficulty moving an area, if they're saying they feel confused, dizzy, nauseous, maybe they have itchiness, a tightness feeling, really anything that they're using to describe their injury would be considered a symptom. So asking these detailed questions for a history and tailing it to that injured body area, like I stated, that's something that comes with practice. For this week, our competency, you are just going to be practicing taking a general history on someone, but I want you to try to get as much exposure as you can and practice this on as many people as you can.